Good morning, everyone. Thank you for joining us. We will be getting started in 5 minutes. Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you will be able to use the chat panel. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. But please remember, you must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. And materials used in today's webinar will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center, and then onto our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as a part of registration remains confidential. Statements of credit will be posted 30 business days after the evaluations closes for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight Friday, May 12th. Up to 2 general continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include the Florida license numbers for reporting when you registered for this webinar. If you are licensed or certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. And now I'd like to introduce our presenter today. Shelby Meaders is the Executive Director of the Florida Harm Reduction Collective. Shelby formerly managed the Florida statewide overdose prevention and naloxone distribution program in the Florida Department of Children and Families Office of Substance Abuse and Mental Health. With several years of experience in the public, private, and nonprofit sectors, she currently directs and presents on harm reduction and overdose prevention initiatives at local, statewide, and national events, conferences, and on podcasts. Shelby earned her Bachelor's of Science from Florida State University and a Master's of Public Health, New York Medical College, with a specialization in health policy and management. And now I'd like to turn the presentation over to you, Shelby.
Thank you so much. Thank you for the introduction and good morning. I appreciate everybody joining us this morning. We're going to talk about harm reduction and prevention and how the two intersect and how we can collaborate. So disclosures and disclaimers, I just want to point out 2 things. The views, opinions, and content expressed in this presentation are those of me, myself as the presenter, and they do not necessarily reflect the views, opinions, or policies of the Florida Department of Children and Families. There are no actual or potential conflicts of interest to disclose for this presentation. This presentation was created without any commercial support. And I'll be monitoring the chat as well. So I encourage attendees to please interact through the chat. You can't unmute yourself, but again, any questions in the chat, or I'll have several questions throughout the presentation so we can encourage discussion and talk about it. So again, just keep an eye on the chat and I will as well. And I know Rebecca did a great job introducing me, but just a little more about me. Like she said, I am the executive director of Florida Harm Reduction Collective. It's a statewide organization, a nonprofit organization that works with harm reduction organizations, prevention programs, and advocates across the state to reduce harms related to drug use. I reside in St. Petersburg, Florida, so I'm in sunny St. Pete. And like she mentioned, I have my bachelor's from Florida State and I have my master of public health from New York Medical College. And I did provide my email address here. This is my personal email, and I encourage anybody with any questions if you don't feel comfortable during the presentation asking, or after the presentation, please reach out, and I'll share that again at the end in the chat. A few objectives we're going to go over today. We're going to describe harm reduction, overdose prevention, and substance use prevention practices. We're going to identify harm reduction and prevention programming in Florida. And a lot of the things you'll hear are very specific to Florida in this presentation. I did that on purpose. But if anyone out of state's on the call or has questions, I'm happy to provide or link to resources. But it is very Florida specific for this presentation. And our last objective, discuss the intersection of harm reduction and prevention and the benefits of the collaboration amongst the two. So let's talk about harm reduction. I talk about it every day. So SAMSHA, the Substance Abuse Mental Health Services Administration, defines harm reduction as a comprehensive prevention strategy, and it's part of the continuum of care. So harm reduction is also a set of practical strategies and ideas aimed at reducing the negative consequences associated with drug use. Harm reduction strategies fall on a spectrum ranging from medications for opioid use disorder to abstinence-based recovery. So breaking down these things just for a second, looking at practical strategies reducing negative consequences associated with drug use. We are talking about drug use here, but if you think about reducing negative consequences associated with something, this could be something like a seatbelt, or it could be a fire extinguisher. Right? We don't want fires to happen. They are inevitable. Just like with drug use, people will experiment or use drugs. But we have something in place that can reduce the negative consequences of that thing, which again, we're talking about now fire extinguishers. So with having a fire extinguisher, you reduce the negative consequences of fires that spread. Same thing with sunscreen. So there's different things that can be applicable in this scenario. Sunscreen reduces the negative consequences of sun exposure. We don't want people to get sunburnt, but people are exposed to the sun every single day. So just kind of, switch that perspective a little bit when you're thinking of harm reduction and how it relates to other things outside of drug use. And when we're talking about strategies on a spectrum, harm reduction is absolutely a spectrum. Participants, individuals that are in the harm reduction field and different participants might, someone might practice abstinence-based recovery. Somebody might use something like Suboxone or Vivitrol in their form of recovery, and those are two of the medications approved by the FDA for medication-assisted treatment. Just different places you can fall in that spectrum related to harm reduction, and managed use as well. Maybe somebody who wants to seek recovery, maybe isn't quite ready yet, but wants to maybe decrease their drug use. That's harm reduction right there. Harm reduction really reduces adverse health, social, and economic consequences related to the use of drugs. And I'm going to play this video in just a second. I'm really excited to show this, but I want to talk about the history of harm reduction. Harm reduction has its roots in multiple movements that came dating back to the 60s, 70s, 80s. So, we're talking about Black Panther Party. We're talking about the women's health movement that came from the 1970s feminist activism. We're talking about the AIDS crisis, right? Back in the late 1980s and beyond, we really saw people that were losing their friends, and they wanted to do something about it. So this is really where we're seeing harm reduction in history. So we're going to go ahead and play this video on what is harm reduction. This video features Dr. Hansel Tukes. Dr. Hansel Tukes is a friend and also an assistant professor and the director at Idea Exchange Miami. So he's down there with a bunch of rock stars like Dr. Tyler Bartholomew at the University of Miami. And NIH is the one that produced this video, the National Institute for Health. So I'm really excited to share it.
Harm reduction was started by people who use drugs to save each other's lives.
Here on 7th Avenue, right under the sun in Miami, is Florida's pioneering syringe service program, the Idea Exchange, where tools like harm reduction, advocacy, and compassion are being used to save lives. At the intersection, stories of research, compassion, and HIV services for people who use drugs. What is harm reduction? At the intersection where compassion meets community, harm reduction takes on a more active role to avoid negative health outcomes. And it does so by meeting the community where they are at.
Harm reduction is basically bettering a person's life and the whole community.
Harm reduction to me is being able to go to a place and get clean stuff to use and not have to like rely on like going to a street and buying it or like hoping you're getting something clean or whatever it is.
Harm reduction is understanding the world of the other and immersing yourself in it for long enough to understand from their point of view. Meeting them where they're at.
Just like we meet people on the street with syringes, I meet my patients by kneeling down. You just have to do what you have to do in order to be on that level and be on the same wavelength of the people that you're taking care of.
Harm reduction to me is making sure our people here are taken care of.
Harm reduction is basically just having a place to go to or people to talk to about anything and everything.
Harm reduction is giving more because that's what they need in the moment.
They offer like, you know, Suboxone to help you get off or whatever it is, like they work with you here. And I just think that's amazing because really we didn't have a place like that.
Suboxone is a medication used to treat opioid use disorder.
So the studies that show people who use SSPs are 5 times as likely to enter treatment.
Syringe services programs like ID Exchange can provide a range of services, including sterile syringes, vaccinations, HIV testing, and help accessing substance use treatment. Nearly 30 years of research shows syringe services programs are safe, effective, and cost-saving tools that can prevent HIV and other complications among people who use drugs.
Last night, that we started 12 people on Suboxone, and those are people who otherwise would not have had access to this life-saving medication, and now they're on their road to recovery. Harm reduction is the first step in recovery. Syringe services is the first step. But now we have the ability to start people on life-saving medications for opioid use disorder. We're helping people in their recovery, but wherever they are on that spectrum. We have to respect the autonomy of our patients and understand that our one way of doing things does not work. We have to adapt and have a personal approach for everybody that we serve.
Harm reduction is holding someone by the hand and saying, you're gonna come with me because I have the time to commit to you because you're worth it. And so what do you need? Do you need to go to detox? I'm gonna go with you. Did you get them to the door? Did you follow up 2 days later to make sure they're still in treatment, or did they fall out? It should be, hey, I'm in this journey with you. You've now met me. You seem to want to do something to better your life, and I'm gonna support you. Let's run that mission.
Harm reduction is understanding and compassion and strength and very nuanced.
Harm reduction, it's love.
Gives me chills every time. Thank you for playing the video, and thank you guys for watching it. I'm just gonna collect myself for a second. Every time I watch it, it sends chills down my body. So yes, so NIDA NIH posted that video last year on their website as a resource for explaining how, what harm reduction is and the research that they're doing around harm reduction, HIV, syringe service programs. So I highly encourage y'all to look at NIDA's resource. And then shout out, of course, to Dr. Tukes and his team there that are really saving so many lives. That's the thing I like about harm reduction, right? So everyone comes into harm reduction work and into the harm reduction movement from different places, whether it's somebody's own personal experience with drug use, somebody's love or grief for a family member or friend they lost, or maybe many friends they lost, professional experiences, commitments, or just someone's own exposure to injustice. And so it all brings us here to preach and to educate and to really work in harm reduction. So talking about harm reduction practices, so different things that you might see in the community. A lot of this you'll see in Florida, all of it you'll see in Florida. Overdose education and naloxone distribution, referral to treatment for infectious disease and substance use disorders. So infectious disease, that could be HIV, hepatitis C, and those are two of the big ones we work with in the harm reduction field, because as we know, when you share equipment, or maybe you don't know, but if you were to share drug use equipment with somebody, you have a high risk for transferring or for sharing infectious disease in that way. equipping people who use drugs with accurate information to reduce infectious disease transmission. So that's teaching individuals, how to use a condom, or what we're seeing as what we're seeing in different supplies across the state, or hearing from people who use drugs, and making sure we're giving them the best and the most accurate information, especially when it comes to reducing infectious disease transmission, which again is HIV, hepatitis C, so forth. That could also include STDs. We work with a lot of different, it's a whole spectrum of things we work with in harm reduction. Reducing overdose deaths and promoting linkages to care. Linkages to care is a very broad statement, but that could be anything from primary health care, mental health care, somebody who needs to see a specialist doctor, wound care, the hospital. I mean, any kind of care somebody needs, social services too. So it's not just limited to like just HIV care or something very specific in our field. And then reduce stigma associated with substance use and co-occurring disorders. So we know stigma is huge. We know a lot of individuals, because of stigma, aren't going to your typical healthcare providers. They're not going to the hospital unless they have to. They're not going to the health department. The way individuals are treated is absolutely affecting the care they receive, because they're afraid to go, and they're afraid to interact with healthcare providers. So, question for the audience. I want to hear from everybody, or not everybody, but from several people, what services are offered at your own organization? Maybe it's something you didn't consider harm reduction, but it's one of the things I just talked about, or maybe it wasn't something I mentioned, but would love to hear in the chat if your organization, or if you as a provider individual offer services, throw it in the chat now. Again, that could be anything from condom distribution, which yes is harm reduction, to education. Even if you don't distribute Narcan, but you educate on it or do the trainings, I mean, that counts as well. Reducing stigma, social media trainings on, different overdose prevention trainings, or trainings on language. We're treating humans as humans, and making sure that they know that they have self-autonomy. We're treating them with respect. These are all examples of harm reduction. Great. I see some good answers in the chat. Narcan distribution, individuals that provide MAT, medication assisted treatment, a lot of naloxone distribution. This is awesome, everybody. And we're going to talk a lot about naloxone distribution and different avenues for it, outside of what you would typically expect from a Narcan provider or distributor. Cool, great answers here. Talking about students working with harm reduction. We're going to talk about schools in just a little bit. Residential youth, supportive housing. Housing is absolutely harm reduction. Talking about housing first, that's a huge piece of harm reduction. It sounds like there's different ages too. We're talking youth all the way up to adult, so there's a good range of providers and participants on here. Thank you, guys. Ooh, support groups. That's a really good one. That's actually going to be very applicable in the next slide or two when we talk about prevention. So going on to harm reduction principles, I think I might have mentioned, I don't know, maybe I did not yet, but a non-judgmental approach. That is one of the most important things. It kind of goes hand in hand with self-autonomy, treating somebody with respect, non-judgment. We're meeting somebody where they're at in their own journey, if they're ready to seek treatment, or maybe they're not, but we're there to provide them with the resources they need in that point in their journey, without coercion, without convincing them to do something, but really letting them decide, what's best for them in their situation. Harm reduction is very supported by evidence-based practices. Everything harm reduction is evidence-based. There's tons of research out there showing that it works. And we'll go through some resources today, but I do know, as far as evidence-based practices, we'll talk about SAMSHA's resource finder, or how to find different programs and resources that are evidence-based. And we'll also talk about some research and where to find those studies as well related to harm reduction. I know one of the resources is the organization that I work with, Florida Harm Reduction Collective. That website, flhrc.org, has a whole resource tab of just studies on evidence-based practices and research related to harm reduction. And again, just driving it home, meaningful participation of people who use or use drugs. So really people with lived experience and stakeholders in shaping drug use and policies and practices. So what does that mean? Basically, nothing about us without us. You want to make sure that you're having individuals at the table that you're serving. So if you're serving people who use drugs, whether you have a community advisory board of people with lived experience, or you have somebody on your board of directors, or somebody on staff, or you hire peers, or you just consult. I mean, you really need to make sure we're encouraging the meaningful participation of the people you are serving, because that's how we know that's how you know it's working, or that's how you see the effect in the community, and you can hear directly from those that it's impacting. And then my favorite simple definition of harm reduction harm reduction in general is just any positive change. Any positive change. Very simple, very, 3 simple words, but that is, if you had a real quick come up with the definition of harm reduction, that's the one I would use. Because that's how we interpret it, right? You don't have to seek recovery or stop using drugs today, but maybe you use a little less today, or maybe today when you have sex, you use a condom. Those are just very basic, examples of any positive change, and we're proud of that. So let's define prevention now. So the U.S. Department of Health and Human Services outlines that prevention is critical to reducing overdoses and overdose deaths. And there's 3 different types of prevention. So we're just going to briefly go over primary, secondary, and tertiary. So primary prevention focuses on the anticipation of occurrence of drug use. So this is before somebody starts using drugs or starts experimenting with drugs. And it's generally directed at your elementary school children, adolescents, it could be all ages, through school up through high school. I don't want to put an age limit on it, but really just before the occurrence of drug use. Examples of primary prevention would be the curriculum Safety First by Drug Policy Alliance. Secondary prevention targets an individual who has already started using drugs. So secondary prevention, an example would be, MOUD, which is medications for opioid use disorder, or when you're pairing that with counseling, medication assisted treatment. This is really where maybe harm reduction can be placed. You were reducing the use, we're encouraging people to use safely, never use alone. We're targeting individuals who have already started using drugs and providing them with those tools they need. Looking at tertiary prevention. Tertiary prevention involves reducing the effects of a disease once it's acquired by that person. So really, we're looking at preventing return to use, which is a more modern or appropriate language or use or way to say relapse. So again, I will talking about language for just a second. I'm really going to focus on using return to use instead of relapse. So tertiary prevention, there was a comment that I mentioned about support groups. That's where support groups would come in. Support groups is the perfect example of tertiary prevention, because again, you're getting individuals together that can support one another on their path or journey to recovery. And really through that support, you're reducing the effects of that disease and preventing that person or persons from using drugs again. So this might be familiar to some people, SAMHSA Strategic Prevention Framework, SPF. SAMHSA does have several grants that utilize the SPF Strategic Prevention Framework, and I'm just going to refer to it as SPF for this slide because it's a mouthful. But they have, people might remember the 2016 through 2021 5-year statewide grant the Florida Department of Children and Families had, which was the Partnerships for Success SPF grant. And there's five steps to this with 2 guiding principles, and it's used a lot in prevention, and that's why I wanted to talk about it. It's one of 2 different models I'm going to talk about. So this provides a comprehensive approach for prevention planners to use. So what I really love about the SPF is that it incorporates a diverse range of partners. So it encourages, multiple sectors to be involved. I mean, that's how we reach more in an audience or reach more of a, on a spectrum anyway, but really just encouraging the different partners to come to the table. And it creates solutions for substance use through data-driven evidence, and it's a model used, and they stress that it's not circular, that it's circular and not linear. So that means a few things, right? So it's circular, so you could maybe do 2 steps at once. You could maybe have to go backwards to a step, but really just as a circular model, you can engage, and it's encouraged to engage multiple steps at once. And we're going back to a step if you need to. And I'm not going to spend too many minutes on the SPF framework, but just kind of walking through the 5 steps. So assessment, we're going to look at assessment as identifying local prevention needs, and we're going to look at data for that. Capacity, we're going to build local resources. So what do we have to work with already? Planning, which is the third step. What works best to address our prevention needs? Or not even, I say our prevention needs, but the community's prevention needs, and whatever community you're working with, whether that's a local or county or statewide. Implementation is the next step, and that's the delivering of evidence-based programs. And then evaluation, which we're examining the process and outcomes, and really working on, well, it leads us right into sustainability and cultural competence. So these are the 2 principles that are integrated into every step of SPF. So cultural competence is interacting effectively with people. Individuals have different values, traditions, lifestyles, and it's making sure that you're meeting the needs of those individuals throughout every step. And then with sustainability, we're looking at, creating an effective system, but maintaining it with the desired long-term results that we're looking for. So I really love that this is data-driven, evidence-based. It's different from other strategic planning frameworks because of that. And with diverse community partners, we're involving community members, the people we serve. We're involving multiple sectors, and to give you examples of like what I keep throwing out, multiple sectors, that could be harm reduction, prevention, that could be your hospital, that could be your law enforcement, that could be education, your school system. It's just like kind of different areas that you normally don't see working together, but come together, and especially looking at prevention can make a world of a difference. And then a complementary approach. So we're going to talk about the socio-ecological model for just a moment here. It's an effective prevention effort that's directed at both individuals who are not yet engaged in risky behaviors. It's in concurrence with harm reduction strategies that we mentioned. And as we know, harm reduction reduces the negative consequence of drug use, or somebody who's actively using substances. And what's cool about the socio-ecological model, it has the potential to impact multiple populations. And so we're looking at the individual, interpersonal, community, and society. So the socio-ecological framework, it helps conceptualize risk factors of opioid use. And again, looking at those 4 different levels, it's multidimensional. So looking at something like opioid use or the opioid crisis, let's break down each of those levels on what that would look like. So the individual level, that's your like socio-demographic factors. That'd be your risk perception. Interpersonal would, maybe you could put in there maybe family history of substance use. Community level would be somebody's access to opioids. Are they readily available? Are they kept in the home? Somebody has a prescription. The treatment availability on the other side, what's the treatment look like in that community for individuals with opioid use disorder? Is it widely accessible? Is it hard to, is there a waiting list? Looking at those things at the community level. Society, looking at law enforcement, educational campaigns, social stigma, discrimination, all different things that are at the society level that can affect a person on how they, on whether they will seek treatment, or the information they learn from others, how they're treated. So really the need to address risk and protective factors early in life and in adolescence is what we're looking at when we're talking about the socio-ecological model and prevention. We must understand these factors that influence substance use. So I encourage looking at both the socio-ecological framework and the SPF framework, or the strategic prevention framework, when working in the prevention field, because it's going to come in handy. And I know I mentioned working across the different levels, is important, but working across them at the same time is really what's going to push us to sustain prevention efforts. So this is really what's helping us understand the effective substance use prevention strategies. And I pulled this from SAMHSA, but I know CDC has a lot of information on the socio-ecological model, and I'm not going to spend too much time on it, but as we go through prevention and harm reduction, kind of think of these models and how things fit into those different levels. So substance use prevention practices. Substance use prevention efforts work to prevent the use and misuse of drugs and the development of SUDs, or substance use disorders. This is from SAMHSA's website. And I just wanted to, I'm not going to click through and go through it today, maybe at the end if we have time, but I wanted to show the Evidence-Based Practices Resource Center. So I clicked here in the, put here in the slide, the SAMHSA link to the resource search. If you just go and filter by substance use prevention, it comes up with all of these different, SAMHSA approved evidence-based practices for substance use. So please, take a look on your own time, or at the end of the slideshow, we can go over it. But you'll just see dozens of great programmings for different ages, different groups, and I hope you can find what you're looking for there. And while we're talking about SAMHSA, I wanted to highlight, this is the Substance Use Disorder Prevention Campaign, the Talk They Hear You. And this is a SAMHSA campaign. It's a national initiative. So it's focusing on underage drinking and substance use under the age of 21. I don't know if others have seen things about this campaign recently. I know my Hulu has an ad about every day on it. I think they're targeting pretty well. I mean, I'm not youth, but they clearly know the field I'm in, because I hear this ad almost every day. So they're doing their job, but it's really cool to hear. I did link it below so you guys can check out the campaign Talk They Hear You. They just did pass their 10th, they celebrated their 10th anniversary, and their website has some really cool resources on there. So they have resources that you can share with, whether it's caregivers, education, providers, healthcare providers. There's a podcast, and they also have an app now, a mobile app you can download on your phone and access the resources that way. So again, just shouting out the substance use prevention resource Talk They Hear You. And I know I haven't listened to the podcast, but as I said, I've listened to the commercials a lot. So substance use prevention in Florida. Here are some examples of substance use prevention practices going on in Florida currently. This list is not endless. These are just a few things that I pulled that I wanted to highlight that are going on in Florida that I can speak on. As of this year, there's free Narcan nasal spray at all county health departments. No questions asked. You could go into a county health department, and they'll give you, I don't know if it's the standard is 2 doses, but if you ask for a kit or two, you can go right into the health department in your county in Florida and ask for it. It is free. I've heard talk, and I've seen one health department, and don't hold me to that, so I'll just say I've heard talk of health departments considering Narcan vending machines. And I've also heard, I know Putnam County has one, and other community-based organizations throughout the state are talking about the Narcan vending machines. Really, this is great. Low barrier access to Narcan for free. Individuals don't feel like stigmatized, or feel there's a high barrier with tons of questions. I mean, it's really hard for somebody to walk into the health department and ask for something, especially if maybe in previous times they wherever they were, not the health department, but wherever they went, they were treated a different way because of their drug use. So really proud of this initiative in Florida. I want to also talk about something within the Department of Health called CORE. So the Coordinated Opioid Recovery. CORE is in partnership with the Florida Department of Health, the Florida Department of Children and Families, and also the Agency for Healthcare Administration. Just the information I was able to pull from the Department of Health's website, looks like there's maybe 12 counties right now in different stages implementing CORE. And what's really cool about CORE, it's a comprehensive approach that works with different providers in different sectors related to substance use. So it's going to work with emergency responders, different designated facilities where they can take individuals who maybe had experienced an overdose or have substance use disorder. That facility can provide medication assisted treatment, and it connects them to care. So it connects that individual to mental health care, primary care, whatever that individual, social services, housing, whatever services that individual needs, CORE can link them to that. And so again, it's still new in the fact that there's only like a fifth of counties in Florida implementing through their health department, but excited to see where this goes. I wanted to highlight, and they don't know I'm highlighting them, but I wanted to highlight Pasco County. I've had the pleasure of going to a Pasco County CORE meeting. And they have some great resources. They have different flyers with QR codes. Somebody can look up information on CORE. And they also partner with their local hospital group, and they have any participant of CORE that's looking to seek treatment can have 90 days of free sober living stay paid for. So it's just really cool. I wanted to shout that out because I've seen the materials firsthand, and I've seen some of the initiatives with their community partners, and I see the difference, and it's really cool. So tons of other counties that are implementing it, and again, really incorporating those other community-based providers. So the recovery community, specifically recovery community organizations, the harm reduction organizations, the groups that are out boots on the ground working with individuals who use drugs or individuals in early recovery, and linking them to care. Wanted to talk about opioid task forces. There are several dozens of task forces around the state. Several counties have their own. A lot of the task forces are also at the same time managing or maneuvering, navigating, I should say, the opioid settlement abatement funds, or the opioid abatement funds. So keep an eye on that if you're not involved, and you're looking to get involved in substance use prevention or harm reduction. Take a look at your opioid task force. Those are also often housed out of the Department of Health. I know several across the state that are extremely strong in numbers and in initiatives, and I'll talk a little bit more about the really cool initiatives we've seen there, collaboration, but I'll wait a few slides. And then to highlight overdose data to action. This is also this is out of this is like out of health departments with the CDC. It fits into the CDC's framework to address the opioid crisis. So with OD2, they call it OD2A for short. This is really focusing on conducting surveillance and research, and enhancing that overdose surveillance and research. So things like the Florida health charts, the substance use dashboard, really with the goal to enhance that surveillance. But the state is developing data-informed overdose prevention activities through that. So you might have seen your county might have an OD2A person. You might see that within your health department, but I encourage you to reach out and see what's going on in your health department, because a lot of these are out of the health department, and they can be a great partner. And this is kind of a great way to delineate harm reduction and prevention, because there is a lot of crossover, and there's a lot of collaboration and a lot of intersect when it comes to harm reduction and prevention, and people may not even realize that. So prevention prevents the behavior, harm reduction prevents the consequences. And it's think of it like looking at harm reduction as a safety net. So common goals of prevention and harm reduction. And I have the question, I have a question for the group again in just a second. But according to SAMSHA, prevention and harm reduction have several common goals. So we're looking at providing interventions for a continuum of people who use drugs. We're focusing on individual and community risks associated with substance use. So think back to those models we were talking about earlier. So that's where that comes in. Incorporate culturally appropriate interventions, going back to one of those, one of the principles of SPF, looking at cultural competence. And then promoting individual and community well-being. Harm reduction and prevention reduce adverse health and social consequences of substance use, according to SAMHSA. And together, really, they can reduce overdose deaths, stigma, and the negative consequences of substance use. So I would love to hear from the group now on harm reduction and prevention collaborations that you've seen in your community, whether it's your county or just within your organization. But what have you seen between harm reduction and prevention, or in the state, if it's something statewide you can think of? And I would love to hear from a few others now on an example. I'll give you an example if no one has one, but I wanted to give maybe 10, 20 more seconds to somebody in the chat. Nice. Narcan awareness. Yep, absolutely. Kind of related to what I was going to say. I didn't want y'all to overthink it. It is as easy as saying Narcan. And even kind of taking that a step further, I'll talk about Take Back Day, right? The DEA Take Back Day is a great example of harm reduction and prevention collaborating. If you have groups there that are educating individuals on the importance of disposing of drugs safely. You have oftentimes that's paired with Narcan distribution. Sometimes we have harm reduction groups out there participating in the Take Back Days. You have law enforcement. So you have different sectors there. You see the collaboration. And again, that's just like one example that comes to mind is DEA Take Back Day, which is twice a year, usually April, October. Oh, someone else said Take Back Day. Great minds think alike. Yeah, deactivation bags. That's great. Looking at the bags that you can dispose of medications in safely, and it deactivates them. Yep, absolutely. Someone mentioned the needle exchange. That's a great example of prevention and harm reduction collaborating. Oh, town halls. That's a good one. Someone mentioned Narcan town halls. I'm going to mention town halls further in the presentation, but I love that one because town halls are a great way to work with the community and assess their readiness, assess maybe where that community's at, whether there's misconceptions or education that needs to be created for specific populations, and really just work to mitigate misunderstandings or things that you maybe need to interpret for a community. Someone mentioned fentanyl testing strips. So that's a great example because we do know in other states there are initiatives where prevention groups do distribute, as do harm reduction groups, fentanyl test strips. Fentanyl test strips are considered paraphernalia as of today in the state of Florida. We might see that change, but as of today, fentanyl test strips are, as is all drug checking equipment, are considered paraphernalia in Florida. So benefits of collaboration. Let's talk about collaboration. So collaboration is mutually beneficial for harm reduction and prevention partners. So together they can do several things. They can increase impact on community. They can expand capacity and range of individuals reached. They can engage all sectors of substance use continuum of care. They can collaborate on overdose prevention strategies, communicate and develop a common vocabulary, and share valuable information from different insights. So I'm going to kind of go through these just a little bit, but looking at common vocabulary. So that's like coordinated messaging between both prevention and harm reduction groups. That could be something that's non-stigmatizing. Looking at valuable information, that could be, information for people who use drugs on xylazine, right? I saw someone mentioned xylazine in the chat, and that would be a perfect example there. So talking about sharing valuable information from different insights. Yeah, so xylazine, there's a lot of new information. It's a very upcoming and it's an emerging substance. There's not a lot we know about it. What we do know about it is stuff we've heard directly from the people that are using drugs. And so through that community advisory board or listening directly from individuals who are seeing it and experiencing it, you can share that information with other individuals. And there's a lot of benefits to reaching, a wider range. Youth are trying substances. They're experimenting. Fentanyl, as we all know, fentanyl is everywhere. Individuals may not have Narcan on hand because, let's say, they're trying cocaine for the first time, and turns out there's fentanyl in it. And cocaine is not an opioid, so Narcan would not work on cocaine. But if there's fentanyl in there, which it could be likely now in the state of Florida, encouraging encouraging Narcan use and have Narcan on hand, just in case somebody were to overdose on something without realizing that they took an opioid. Have you witnessed other benefits? I would love to hear from anybody that wants to enter into the chat if you've witnessed other benefits. Again, this is not a lot of the slides. These are not exclusive lists. There's more to, what I'm elaborating on, but would love to hear other examples. But really just driving home, the collaboration is mutually beneficial for both partners. And you can reach more people and cover more ground that way. And just addressing a question in the chat, just so it doesn't, move out of my eyesight and move too far along. But do we have xylazine testing or test strips? Xylazine test strips are now available throughout the nation. They are still considered paraphernalia in the state of Florida. So that's all I will say on that. But yes, there's a company or two that have produced them. The only thing I would highlight, I don't see the xylazine test strips or testing becoming legal anytime soon, only because the bill that may be signed soon regarding fentanyl test strips is specific to fentanyl test strips. So if fentanyl test strips become legal, it would just be those fentanyl test strips. You can't test for other things. That's still illegal. It would be paraphernalia still. So there are test strips available that do test for xylazine. I know BTNX, Dance Safe might be coming out with one in the summer. Well, they are coming out with one in the summer, I should say. But again, in the state of Florida, they are paraphernalia. So talking about the intersection of harm reduction and prevention. So again, as I mentioned, we're achieving a greater reach, expanding capacity, whether you're hosting events or trainings or just learning from one another. There's a lot of benefits to prevention and harm reduction collaboration. So they share values and principles. They both emphasize evidence-based interventions. They both acknowledge the harmful impact of stigma and stigmatizing language. They both focus on risk and protective factors, and think again back to those models I spoke on several slides ago, the social ecological and the strategic prevention framework. Recognize the importance of cultural competency. Understand the value of working at the individual and community levels, and taking approaches that address different risk environments, and collaborate across the community sectors to build a comprehensive approach. And this actually, something that comes to mind right away is when I talk about collaborating is with funding, right? So collaborating with partners would really stretch when it comes to funding, because, we can partner all day long, but if, when we're looking at sustainability and really building out a program, groups are going to talk about funding, but that's a great place to look for maybe a prevention group and a harm reduction group to go in on an initiative and to maybe create a funding proposal together. And then you're able to share more resources, share a bigger network, and you're able to listen to those again. And I've said this already, but listen to those you're serving and inviting them to the table, and are really putting those individuals at the forefront, because that's who we're impacting. I did see one more question in the chat, and I just wanted to address it real quick. Someone had mentioned test strips being considered paraphernalia. There is a caveat there. The test strips are urine are typically used to test urine. So used in another environment or at a hospital or something, that is not illegal. Using a fentanyl test strip for the purpose of testing a substance for fentanyl for drug use, that is where the paraphernalia piece comes in. And there is a bill going through right now that might be passed to decriminalize just fentanyl test strips, but TBD. So intersection of harm reduction and prevention. I love when individuals are chatting in the box. So please put your answer in here, type some of your answers. There's no like real answers to these questions, but I do want to hear from others. Like what are the goals of collaboration between prevention and harm reduction? What would you personally like to achieve through collaboration? Is this something you've been thinking about as a prevention or harm reduction group, or as neither of those and you're wanting to work with both prevention and harm reduction? How will engaging organizations and members of people of the drug using community or people who use drugs help you achieve said goals? I've already mentioned it, that we want to, involve people who we're serving, but, why does that help us achieve those goals? Well, by partnering directly with people who use drugs, you can uncover, what's working the best, what's the most effective, what's working and what's not, and then what are you seeing in the community on what you're hearing and what we're seeing. Oh, I love some good answers in the chat. Decrease bias, improve the different organizations, collaborating with people who use drugs, reducing stigma and attitudes in traditional medical and substance use organizations. This is all wonderful. This is true. I mean, there's a lot more than just these answers, but things to think about, having a harm reduction group do a harm reduction 101 training at your meeting, whatever kind of meeting you're holding, or hosting like a language training and having a prevention provider come in and discuss that with your group. Different ways to really, intersect both of those and collaborate. So prevention's role in harm reduction. Prevention partners can bolster harm reduction efforts by promoting community readiness for harm reduction, addressing stigma of substance misuse and substance use disorders, providing education and resources, coordinating strategy implementation, and linking harm reduction to upstream strategies. So what we're going to do is we're actually just going to break down 1 through 5 now, just piece by piece. And I do see something great in the chat, and you took it from me. I was going to shout out CCA in my next slide. So yeah, Community Coalition Alliance is great at bringing different partners together, and as mentioned in the chat, helping everyone understand the different approaches and to be more effective overall. So yeah, great example there. So talking about the promoting community readiness. So looking at discussing misconceptions of harm reduction, building community readiness, and building support among stakeholders. So these are different things you can do by hosting town halls that I mentioned earlier, roundtables. There's, recovery roundtables that exist throughout the state that are very effective. So different roundtables where you're just bringing those different stakeholders together and talking about your needs and what you offer as a provider, or what you need that somebody else could provide, and really just kind of filling those gaps on what's missing in the community, and how to make all of the services better without recreating the wheel, and without everybody sharing the benefits, and not just siloing and not sharing the successes of a given project, right? Because if you're succeeding in something, it'd be great to share that with others if they were to want to collaborate or take on a similar project to reach more individuals. Just conversations, having the conversation on prevention and harm reduction, and really just decreasing the stigma associated with that. Hosting different trainings. I mentioned like a language training that's like your person first, using substance use instead of abuse. Talking about, instead of saying addict or junkie, we're saying people with opioid use disorder, or people, persons who use drugs, something like that. And then let's see, prevention's role in addressing stigma of substance use. So we're looking at educating the community stakeholders on addiction and recovery, promoting the use of non-stigmatizing and person-first language, as I just mentioned, and then encouraging the community to respect autonomy and dignity of those with substance use disorder. So providing education, and I just give a few examples of education here, but really tailoring the message to building support and awareness for harm reduction interventions. So this could be trainings or education that talk about how to identify an overdose. That could also be how to, signs and symptoms of an overdose, how to use naloxone or how to locate naloxone maybe, how to reduce post-overdose risk, and how to access recovery supports. So that could be, linking or sharing information on the local recovery community organization or the statewide Floridians for Recovery, or any organization that employs peers, people with lived experience, to support people in their recovery. And again, these are just examples that, education and training can go far beyond this. But these are just few of the easy ones that I would encourage anyone to implement within their organization. So looking at strategy, coordinating strategy implementation, and I'm going to go ahead and finish. I'm going to work on this slide for a minute because I like what I'm going to say for it, because I have a really cool example. And then we're going to go ahead and take a 5-minute break after this. Well, really cool coordinating strategy implementation. So, assessing efforts that already exist, collaborating opportunities, bringing together different sectors and partners. And I know it might feel like, seem like I'm repeating myself a lot, but I'm really driving home I'm emphasizing these specific strategies, really bringing home and bringing together prevention and harm reduction. So bringing together the different sectors and the different partners. And then together, those partners can work through barriers and obstacles. You can share successes, and then you can navigate through the challenges together. And that's how you get more done. So I said, as an example, that, first assess the efforts that already exist. So for an example, at a local level, you might have an opioid task force. So in one area of the state, there was a task force that took on an initiative for spring break. So it was a spring break outreach initiative with Narcan, and they were able to create a flyer with some myths, or like kind of some quick facts addressing Narcan. It's safe to use. It's safe to use on somebody else. Like, carry it on you even if you don't use drugs, and this is why. This is the law that protects you. It laid out some very simple, easy, frequently asked questions around Narcan, in partnership with both the local county health department, the opioid task force, a local recovery community organization, and a local community based organization, and a local harm reduction organization. Those groups went out with a flyer. It had all of their logos on there, and they, not all of those groups, but the community-based providers. So the recovery community organization and the harm reduction organization went out, boots on the ground, and distributed Narcan to the beaches. And they were able to do this in collaboration with the health department. The health department was able to provide them with hotspot data on what, so this was beach outreach for spring break. So they looked at last year's numbers on where the hotspots were related to overdose or suspected transports for an overdose. And they were able to target locations. So being, proactive, not reactive here, and targeting the locations that saw a lot of activity last year. So for March, April, May of this year, these groups went out, and again, as a coordinated strategy, and hit the beaches, and they hit an entire county, an entire strip of beaches, dozens and dozens of individuals and businesses. So it was kind of two-pronged there, working with both individuals who may witness or experience an overdose on the beach, and then also the business providers. And you might have seen this across the news. I think it was last month it was going a little viral on in the news, because it was a really cool coordinated effort. But again, working with those business providers on the beach, saying, this is Narcan, it's free, this is how you use it, it's legal to have. You may have somebody who overdoses, and we know they do, and they know they do, they acknowledge it. But really just working around increasing the awareness of what Narcan is. And I can say a lot of the bar owners and restaurants already, they didn't have it on them, but they absolutely knew what it was. And they were happy to take it. So this is just one example of a coordinated strategy, again, reaching more individuals, including the people who you're serving, I'm inviting them to the table, and you reach a wider audience this way. So I'm going to go ahead and take a 5-minute break, and then we'll go ahead and resume.
All right, everyone, we will meet back here right at 11:05. Welcome back, everyone. A link to the PowerPoint is also listed in the chat if you want to look there for it, if you are looking for it. And Shelby, I'm going to turn it back over to you.
Thank you so much. All right, welcome back. And again, if anyone has any questions at any time, I encourage you to put them in the chat and I will catch them as I can. But I don't want you to forget the questions, so definitely put it in the chat and we'll go from there. So we're going to pick up, we just talked about coordinating strategy implementation. I gave the example of working with a harm reduction organization, a recovery community organization, the health department, and a task force to reach the individuals at risk of overdoses during spring break. So that was the perfect example of collaborating and the prevention's role in that. Now we're going to talk about upstream strategies. So an upstream strategy refers to policy changes, something impacting the entire community, addressing social determinants of health. So examples would include prevention services for children of people who use drugs, or policies that address both harm reduction and prevention. Downstream strategies, on the other hand, are designed to prevent overdose and related consequences. So again, upstream strategies are designed to reduce substance misuse in the first place, and that's really where we're coming with policy changes and impacting the entire community, addressing social determinants of health, and then linkages to strategies to promote factors that protect against future substance misuse. So this is where I was going to highlight Community Coalition Alliance. This is an example of a successful partnership. So prevention coalitions throughout Florida distribute naloxone to individuals. So I know, and I didn't tell them I was highlighting them before this call, so I hope it's okay. But Community Coalition Alliance is known throughout Florida. It's an alliance of different community-based coalitions. They offer trainings, they share resources, they have regular meetings Tuesdays at 2. They have drug epidemiology network meetings. They share data, and it's the prime example of collaborating across sectors. I know harm reduction organizations that attend these meetings. I know law enforcement, fire rescue, prevention, education, treatment, all different sectors that come together to collaborate here. And they educate individuals on how, as I mentioned, how to recognize and respond to an overdose, the laws surrounding an overdose. So that could be the Good Samaritan Law, the Emergency Treatment and Recovery Act, and these are Florida specific laws. Risk factors for an overdose, risk factors, not using alone, the importance of polysubstance use and how different drugs can increase, combining different drugs can increase a risk for a fatal overdose. How to use Narcan, how to administer it, how to find it for free in Florida, how to, find it at a pharmacy, and how to report an overdose. So that was kind of my highlight there on highlighting prevention coalitions, but more specifically, the one on my radar, which is Community Coalition Alliance. But and I didn't put a little thing here for y'all to add yours in the chat, but would love to hear of other successful partnerships you've seen. So if you know of a county level or another prevention coalition doing some of this work, drop it in the chat. I would love to see it and would love to shout it out as well. So any kind of examples of successful partnerships here between prevention and harm reduction. And I also wanted to talk about talking about overdose prevention, highlighting Florida's learning management system. So it's a new website, floridalearner.org, and you'll see a lot of the trainings that were previously posted on the Florida Certification Board, if not all of them, but you'll locate the opioid overdose prevention, recognition, and response training there. It's a recorded training from, I believe, 2021, but still extremely relevant. And I would encourage anybody who maybe wants more information or wants to share this training. Maybe you want to know more about overdose prevention, Narcan. If you want a more in-depth training on signs and symptoms of an overdose, how to respond to an overdose with the recovery position, or maybe you just want to know more about the Florida specific laws related to overdose in Florida, I would encourage you to make a free account, go to floridalearner.org. And you can search for, check out all the trainings. They're all great, but you can search for specifically the overdose prevention training to learn more information. And also happy if you email me, you can, ask any questions you have too related to overdose prevention. Examples of overdose prevention practices. So again, naloxone distribution is one that comes to mind right away, but it can be more specific to fentanyl education and awareness. Now we are seeing fentanyl in a lot of different types of drugs, and there needs to be a lot of education on that. And again, kind of I mentioned earlier, somebody might overdose on fentanyl and not realizing that they took fentanyl. Maybe there was fentanyl in their meth, which is methamphetamine, which is not an opioid, or it could be a benzo, fentanyl in their benzo, or cocaine, or something that's not an opioid. And again, when they don't have Narcan on hand, they're overdosing. And it could be a fatal overdose if you don't have Narcan on hand. Education on emerging substances. So talking about xylazine and nitazine, and there's other substances that are on kind of on the forefront, but really xylazine is the one that comes to mind right away. But talking about like what that looks like, and I don't have a slide dedicated to xylazine, but you want to make sure you're informing individuals who use drugs or who might come into contact with xylazine on what we're hearing in the streets. So, wound care for xylazine is the opposite of wound care for any other wound. So like with xylazine, you have to keep it moist, and it's like recommended to use Xeroform or Vaseline. You're seeing really nasty wounds with xylazine. Narcan doesn't work on xylazine. Xylazine is a horse tranquilizer. It is not an opioid, so Narcan's not working on it. But like in making this brief, like what we're seeing with xylazine is somebody who overdoses, you give them Narcan and they start breathing again, but they don't wake up because they're tranked. They have a horse tranquilizer in them. So talking about different steps to overdose response there with xylazine, you want to make sure the person has 10 to 12 breaths per minute. If they go under that, then you would give them more additional Narcan. So really the education on emerging substances is extremely important, because now we're seeing xylazine in a lot of fentanyl supplies, and it is here in Florida. We are seeing the wounds all across Florida. And it's very scary. So wanted to highlight that, and how, emergent substances, again, it looks different from what we're used to seeing, and that one is not going away. Talking about overdose recognition and response training. And then I also put in here naloxone administration training. They could be one and the same. I'm going to kind of talk about them as if they're two different things. Talking about overdose recognition and response training, I think of that as like the 1 hour training I just mentioned that's on floridalearner.org. That goes into detail or depth about like harm reduction, overdose prevention, like the laws in Florida. And then when I talk about like naloxone administration training, that's like a 30-second, 1 minute training that you could easily give somebody on how to use Narcan nasal spray. And like the quick tips around it. You don't have to prime it or test it. It's one dose and you can toss it afterwards. Put somebody in the recovery position, call 911. Not all in that order, of course. I was just kind of listing off some things, but again, so I kind of delineate those as, overdose recognition and response training is a more in-depth training that you could do, teach to one individual, but likely more so a group or an organization, or you're like watching a webinar. And then the naloxone administration training is like a real quick 30-second, 1 minute training on how to use Narcan, and how to if you're just giving somebody a box in front of you and you have to run down how to use it with them. And so it does sound like a lot of people on the call today are familiar with naloxone. Maybe you're already distributing naloxone within your organization or as an individual. But I'm going to pretend like y'all don't know what naloxone is, just because in case there's anybody on the call that maybe is exploring distributing Narcan, or maybe this is the first time you're hearing about it, but you're involved in prevention, and you're looking to get more involved. Oh, okay, perfect. So somebody did say that they're not familiar with it. So I'm just going to start, and I apologize now that I put this at the end of the slide when I've talked about it a lot already. But naloxone is the generic name of Narcan nasal spray. I'm going to talk about Narcan nasal spray today. That's the product that's given out. It's saturated the state of Florida, and it's the product that a lot of community-based organizations give out. So I'm going to specifically just talk about the 4 milligram Narcan nasal spray today. So Narcan is used to reverse opioid overdoses. It can only be used to reverse opioid overdoses. So if you were to give it to somebody who maybe looks like they've overdosed, but it turns out they're just sleeping, it's not going to harm them. If you were to give it, if a child were to get their hands on it on accident, it's not going to harm them. It's only going to essentially remove the it's gonna remove the opioids from the receptors they're on, and then Narcan, what it essentially does is sit on those same receptors. It has it has a stronger affinity, so it's able to kick off the opioids off the receptors and occupy those same receptors for 30 to 90 minutes. So it lasts for 30 to 90 minutes before it wears off. Somebody could go back into an overdose, so you'd want to give them more if they were to go back into an overdose. Narcan is not a new product. So it's been around. It was FDA approved back in 1971. It was used commonly by medical personnel, where you saw like a syringe with a generic vial that you'd have to titrate and pull back in the syringe. And that's still used today. Some individuals, a lot of harm reduction organizations throughout the nation prefer using the generic naloxone. But now we have like a really easy product called Narcan nasal spray. It's really easy to use, and that's kind of what's different now. So although it was approved in 71, the new concept is now it's encouraged for lay people to carry naloxone on them. And again, it just reverses opioid overdoses. It takes 2 to 3 minutes to start working, which sounds like a lifetime when you are witnessing an overdose. And it is a lifetime. We encourage everyone to call 911. It does take 2 to 3 minutes for it to start working. You can always give another dose, but again, just waiting the few minutes in between each dose, I have to stress, just because the more Narcan you give them, essentially the stronger that withdrawal is going to be. So it does precipitate withdrawal symptoms, which is like flu-like symptoms. So that could be, somebody vomiting. You're not going to feel great at all. I've heard it's one of the worst feelings in the world. Muscle aches, nausea, fever, somebody who's sweating. I mean, they're just not going to be comfortable if you're experiencing withdrawal. And that's what happens when you give somebody naloxone, unfortunately. Like, you're saving their life, but you're also putting them into withdrawal. So the more naloxone you give them, the worse those symptoms are going to be. So again, yes, you can give another dose if it doesn't work after a few minutes, but wait the few minutes. We have heard where a few doses may have to be used on somebody. Fentanyl is extremely strong. It's 50 to 100 times more potent than heroin. So very strong, but naloxone does work to reverse fentanyl overdoses. So naloxone distribution in Florida, organizations operate under standing orders in Florida, which is just a blanket prescription signed by a provider to allow for the distribution of a medication, because it is still a medication. And you can hand out free naloxone kits directly to people at risk of witnessing or experiencing a drug overdose. So yes, currently right now, organizations utilize standing orders to distribute it as a prescription medication. As of March, it was announced that the FDA has approved Narcan nasal spray, 4 milligrams, for over-the-counter use. So no details on that yet, but as summer rolls around, maybe there'll be some information to share on what that looks like, maybe the cost of it. I have heard maybe under $50, what they're going to try to keep it under. But I'll focus on, I do want individuals to know how to get it from a pharmacy. I think that's really important. But I would also like for individuals to know how to get it for free in Florida. That's one thing Florida has going on, is we have a very robust overdose prevention program that's run by the Florida Department of Children and Families. And they keep it low barrier. They keep it free. They distribute it for free through organizations. By doing this, we're reducing obstacles like the cost of it, not being able to have a car to go, to a pharmacy, lack of access in that sense. And then, encouraging secondary distribution. So not just saying, oh, you can only have one kit, one per person, but saying like, oh, thank you. I'm glad you felt comfortable enough to approach me. Here's 5 kits that you requested for your buddies. Maybe next time your buddies will come too and seek services, but that's not forced, that's not pressured, but really encouraging that secondary distribution, because not everyone's comfortable, and we can really reach farther and wider into communities by emphasizing and engaging in secondary distribution. So Florida's naloxone distribution program, which is through the Florida Department of Children and Families, they partner with hundreds of organizations, and I don't know the exact number. I want to say it's over 300 now. But I did put their email address here, so I would encourage anybody on the call that maybe is exploring naloxone distribution. You know, maybe maybe you already distribute and you're just thinking, oh, I need a new order, and you want to reach out to them. You know, touch base with them. There are new calls coming out that you'll hear about soon if you're already enrolled in this program. It's like monthly calls to network with other organizations distributing Narcan, so you can really learn, you know, learn from others, the successes, the barriers, learn about those emerging substances we talked about, like xylazine, learn about the trends, what the data is showing us, what, you know, through both in-person distribution and through mail-based distribution. So again, there's the email, isavefl@myflfamilies.com. If your organization is interested in distributing naloxone, you know, to both individuals at risk of witnessing or experiencing an overdose, please reach out. They have saved, it's over 20,000, but I don't know the exact number, so I'm gonna confidently say at least 20,000 lives since 2016. And that's just from individuals. And we know this is underreported, but from the individuals that went back and told them that they used the Narcan they received from this program, we know of at least 20,000 times that has happened. And that like puts a bubble in my throat, just saying that out loud. So just wanted to highlight their program. It's an awesome program run by awesome individuals. And what's really cool about this program, and why I'm talking about it here on this call, for people who may, you know, maybe you're not in the prevention field or you're not in the harm reduction field, but you want to get involved, and this is your way that you could start, because we're not just talking about you know, prevention organizations or syringe service programs that distribute naloxone. Yes, those are two prominent ones that distribute, but also hospitals can distribute to people at risk when they're being discharged, whether that's from the ER or from the maternity unit after giving birth. Shelters can distribute naloxone, whether that's a domestic violence shelter or a shelter for unhoused individuals. Churches are the faith-based community is really important here, because individuals are overdosing at churches, in the parking lot, after service. This is something that we've had a lot of conversations around recently. So there's going to be a huge drive soon in the faith-based community. So for anyone involved in that sector, you know, would love to hear from you too. So churches and food drives, we've seen that coupled often, where food drives are working with churches and they're pairing it with Narcan distribution. Because again, it's a lot of the same individuals that you're going to come across, and it's just, you know, it's easier to reach, again, a wider audience that way. I mentioned syringe service programs, county health departments now, as I mentioned, treatment centers, leave behind programs through law enforcement or fire rescue, recovery community organizations, which are organizations that involve individuals or peers with lived experience, assisting other people, you know, on their path to recovery. So this is iSaveFL. This is the website used by DCF, or the Department of Children and Families, where you can locate free Narcan. And I'm excited to see maybe some future changes to this campaign, if there's you know, some more to come with iSaveFL. And I love the look of it. And there's so many providers now. So, you know, if you go to the website, which is isavefl.com, again, isavefl.com, you can click Find Naloxone in the top left corner. It's the first tab, and then it brings a drop down. You can click your county in the drop down. In most counties, if not all but one or two, have providers listed, and you can see all the contact information from that provider, that maybe the hours they operate, if they have a website, a Facebook, their phone number. You can reach out, or you can just go and get Narcan for free. The providers, if you're enrolled in DCF's naloxone program, you're not required to be listed here. But they do encourage it. But if you agree to be listed, you also agree, you know, no questions asked, to distribute naloxone to the individuals that contact you through this website. So again, it's not required to be listed. Not everyone is, but there are tons on there. So I would encourage you to go to iSaveFL, click your county, or see some other counties that have providers, and click through it and kind of see what's in your area. And again, reach out to Jennifer and in the rock stars that run the iSaveFL campaign and program. If you're looking to distribute Narcan, or if you have any questions about the standing order or the enrollment process, or if for some reason you're already enrolled and you're not showing on the map and want to be enrolled, they can definitely help you with that as well. I'm just entering the website into the chat now, isavefl.com. So let's talk about how to integrate overdose prevention into your work. And this can be any work. Again, this could be somebody who's neither in the realm of harm reduction or prevention. But many partners across sectors distribute naloxone, as I gave you those examples. But, and I actually didn't, well, I mentioned shelters, and I guess I mentioned food distribution, but I did not mention mutual aid groups. And that's one that's also increasing in presence and size across the state too. So many different mutual aid groups that are out there, boots on the ground, providing first aid and housing support and linkages to care, and really providing individuals with those resources they need, whether it's condoms or Narcan. These are the partners that are reaching individuals who use drugs, because that's really where Narcan is intended to go, right? Directly to individuals at risk of witnessing or experiencing an overdose. So even if an organization does not distribute Narcan, or maybe that's a big step and you're not ready to do that yet, it's still great to even just educate staff and volunteers on it. Maybe you're not ready to distribute it, but you want to keep one kit on site because maybe your clientele involves individuals who use drugs. It's still great to keep on site. It's great for your staff and volunteers to know Narcan, how to recognize and respond to an overdose, how to give somebody naloxone, or even how to educate an individual on how they can find it themselves. So let's say you're working at a doctor's office and you don't want to distribute Narcan, but it'd be great for your staff to know what Narcan is, have an overdose response training, and maybe keep one kit behind the counter if it's needed, and not to like I don't encourage holding Narcan if it's not necessary, but if you feel that kit would be beneficial there, keep the kit on site. And then working with individuals who use drugs, if that's who your participants, your clientele is, you can easily hand them a one-pager on saying, hey, we don't give out Narcan, but check out iSaveFL, and here's the 5 providers in the county that distribute Narcan. I mean, that works too. That's been done through hospitals. If a community hospital didn't or could not distribute yet, they gave it just a piece of paper with the all the ways to find free Narcan near them on just a piece of printer paper that they printed out, using Word, pulling directly from the iSaveFL, and you can hand that to anybody. That's the easiest thing you can do to link somebody directly to a medication that can save lives. So engaging partners to prevent substance misuse and use. So community stakeholders to involve to enhance prevention efforts. And again, this is not endless. These are just some examples, but looking at community health centers, community-based organizations, local schools, university colleges, recovery community organizations, which, as I mentioned, recovery community organizations are organizations run by and involve people with lived experience of drug use, people who are in recovery, and through that they build recovery capital and work with individuals on their pathway to recovery. Poison control centers, medical examiners. Really, these are all different ways to integrate overdose prevention across sectors. It's important for schools, restaurants, churches, healthcare providers of any sort to talk about this and to engage, community stakeholders. RCOs, I mentioned they're peer-based. They provide recovery community services or recovery support services. They also incorporate public education and policy advocacy. They work with local communities of recovery. They're typically nonprofits. There's several in Florida. I would probably say a few dozen. So that's a great partner to look to here if you're in Florida. Poison control and medical examiners, both great partners as well. I always stress that data coming from the medical examiner's office is the most reliable source of data in Florida. Strong words, but I believe it. So the medical examiner produces annual reports on drugs found in decedents. So basically looking at the drugs found in somebody's body at the time of death. And so like we haven't seen 2022 numbers yet, but looking at 2021, those reports shows us, the presence of fentanyl and xylazine was on that report too. So interested to see kind of what comes this year. But medical examiners are a great partner. I often see them involved with a lot of task forces, presenting on data, preliminary or what have you. But same with poison control centers. I've seen them also on drug epidemiology network calls or DEN calls, task forces as well. But poison control is a great a great partner, and they often have numbers and data related to Narcan and overdose prevention. So take a look at those partners if this is typically not individuals or stakeholders that you work with, but they could all enhance your current efforts. And then I would love to hear from the crowd. Is there anybody that's a community stakeholder, maybe that I accidentally left out here? I would love to hear from you if you just are not listed here. I'll take just 10 seconds and see if there's anybody that wants to drop what type of stakeholder you are and how you enhance prevention efforts in the state or beyond the state. Oh, Guardium ad litem is a great one. Yep, coalitions. Yes. Great examples. Again, touching on those cross sectors and across different sectors here. So you can kind of just see how the more at the table from different sectors, the more perspective you have and the more experience and the wider reach you have. Oh, great one. Somebody said the Department of Juvenile Justice, working with the state agencies and national or federal agencies to bring everyone at the table that needs to have a say. Yep, looking at nonprofit advocating for resources and recovery. Yes, and incorporating those community-based organizations here that can share different resources. And then managing entities. Yes, in Florida, we have managing entities that for behavioral health and substance use, they manage those services for each part of the state in Florida and contract with providers for those services. So managing entities are great to involve here. And they can absolutely enhance prevention efforts, not only with funding, but just having their support and their wide reach as well. So that's a great partner. Safety councils, healthy families, Florida. Yep, community-based organization. Great examples. I appreciate the participants for chiming in there. So how to locate services in your area. I always just like to include, talking about all the things that are going on in Florida. Well, how can you find different things in your area, or if you know somebody that's looking for a service, a specific service, where can you direct them? So I always like to throw out the national helpline from SAMHSA. So it's a phone number, the 1-800-662-HELP or 4357. I would say SAMHSA's treatment locator is a good one, the findtreatment.gov. You can also text just your zip code to 435-748. And again, I know you'll get a copy of these slides, the slide deck to share, but just shouting these out. And maybe you're familiar with them, or maybe it's new to you, but just wanting to pass on some very helpful resources, especially now with the texting options, because even a website, calling, it's sometimes as easy as a text is really the go-to, and it's simple. I know, that's what I would do. Calling 211 or visiting 211. And actually I wasn't able to add it on the slide, but there's a texting version for 211, and I would actually text first. I tested it out myself. I have heard a little bit with like some wait times or not being able to reach someone for 211, and I don't know if that was specific. I don't know what specific area that was in. So there are different providers that pick up different areas of the state for 211, but I had a great luck with texting, and I'll put this in the chat, but texting 898-211. So if you text, and again, I'm going to put this right in the chat. You're going to text this number, and you can text hi, you can text anything. You just have to send a text to. And then it's going to ask for your zip code. So right away, it'll ask for your zip code, and you can just put that in. And then it's going to ask you a few questions, what service you're looking for. So you can put housing or substance use treatment or what have you, whatever that services you're looking for. You can just text right away. It seemed like he was a real person. It had a name to them, and they were texting back with me. So, you know, I would love to hear any feedback on that resource. And it is by zip code, and then you can search for what you're looking for, what service for whatever participant is needing. You can visit the findhelp.org. This is another great resource where you can look it up by city or by zip code if you're looking for something specific. Let's say, I mean, I've seen, you know, Narcan from my program on there, like Narcan distribution or mail-based services. So you can go and look up a specific group that see what services they offer, or if you're just looking for, let's say, substance use treatment in Duval County, and you could put that there as well and see what you can find. I also included the MyFL Families, which is the DCF, Department of Children and Families, SAMH Get Help link. And this is also how to find local services through DCF's website. And you can pare down what you're looking for, whether it's substance use, treatment, medication-assisted treatment, and then the 988 Lifeline. So you can call, text, or chat 988, and this is the newly launched Suicide and Crisis Lifeline. So I would encourage anyone to just you can go to that website and see what resources they offer, but it is specific to suicide and crisis. So wanting to talk about HHS. HHS supports harm reduction and prevention. So this is the federal White House website. They've been releasing press releases talking about their overdose prevention strategy, and they have 4 different pillars. And this is first of its kind. It's really amazing to see at a federal level here. The 4 pillars, including primary prevention, evidence-based treatment, harm reduction, and recovery supports. So this prevention strategy focuses on an array of substances, so involving an array of substances involved in overdoses, also incorporating innovative treatment approaches for substance use disorders. So they released their latest press release, or at least the latest that I found was April in 2023. So they announced that they were launching a campaign to educate on the dangers of fentanyl. And so they were focusing on educating young folks on naloxone. They mentioned and highlighted their focus on college campuses, gas stations, bars, and restaurants. And again, this is the Health and Human Services federal website through the White House, through the .gov. And I'll share that as a resource as well. But kind of think of ideas for collaboration here as we walk through these different pillars. The press release in April mentioned using the state opioid response or SOAR funds for collaborative projects, called out harm reduction, which was the first of its kind. And then, last year in August 2022, they released a press release that highlighted prevention and the new overdose prevention strategy supporting substance use prevention. They talked about investing in community resources to help prevent harms related to substance use. So really, the overdose prevention strategy is prioritizing advancing evidence-based treatment, and it's directly calling out both harm reduction and prevention, which is a first of its kind, and the collaboration that can take place between the two, and again, how much more we can get done by through that intersection and through that collaboration. Well, today, guys, is National Fentanyl Awareness Day. How fitting. So I thought this was, I was really excited that it fell on this day. It was not planned. But National Fentanyl Awareness Day, it is today. It's a campaign that's newly launched that is really focusing on not stigmatizing drug use. It talks about knowing the signs of overdoses, the signs of an overdose, how to, encouraging to carry naloxone on you. Because again, it's encouraging lay people to carry naloxone because you never know when you're going to see somebody next to you on the bus or in the car next to you or on that airline. And I use the airline example a lot because it terrifies me. A couple of years ago, there was an overdose on a Delta flight and they did not have Narcan on hand. And since then, it's now protocol for all airlines to carry Narcan. So it's like you never know when you're going to need it. And so really this campaign drives home, carrying naloxone and then encouraging those open dialogue conversations about fentanyl and talking about it at home and at school. And I included just one example of a social media tool here. And I shared the website, thefentanylAwarenessDay.org. And they have tons of like social media resources and a toolkit. You can share information on Fentanyl Awareness Day. What I liked here, because we've been talking this whole presentation about collaborating across sectors, and this campaign does that. So it brings together all different types of huge partners, Snapchat, Google, Song for Charlie, YouTube, the cross-sector collaboration, reaching more wider audience. So I would encourage y'all to share. I would encourage a lot of people on the call today to, if you can, to share on your social media something from the Fentanyl Awareness Day. I know my organization will, and I will personally on my social media, because you just again never know when you'll need naloxone, and we really need to increase the awareness of fentanyl and the dangers of it. The dangers of it being in your supply that's not an opioid, right? Again, the accidental overdose and not even knowing that you consumed fentanyl. Fentanyl is in non-opioids, and we need to make sure people have it on hand. So I thought it was super fitting that National Fentanyl Awareness Day is today, May 9th. And if you go to fentanylawarenessday.org, you can see all of the resources that they have. And it's like it's so much more than just like a social media toolkit, but there's tons of education for schools, for for the educational providers, for teachers, for healthcare providers, for families, caregivers. So check it out, because this is how we can really reduce the stigma related to drug use and the stigma related to harm reduction and the stigma related to all of this. So I was excited it fell on today. I'm excited to highlight it. It has, info, knowledges, resources, as I mentioned. A lot of their other partners involved, and it's on their website, but Dance Safe and the National Harm Reduction Coalition, the DEA, Google, I mentioned, Shatterproof was another. So those were all collaborators through that campaign. I am at the end of my presentation, but I have a few resources I would love to walk people through. I've picked out just one that will take just a few minutes to go through. So I'm going to go ahead now and do that. But in the meantime, because I do see a few others added some resources, naloxoneforall.org, 211live.org. I really appreciate adding the extra resources there, and would encourage others, if you know of resources to find services like for substance use disorder or whatever resource is needed in the community, please share it in the chat if you know of something good. Or if you know a shortcut to it, like I found out recently, the texting option for 211 was really effective. So I would encourage others that are hanging on to put questions in the chat. You can put any type of question in the chat as I navigate this resource. And then please contact me again if you have any questions. My email is my full name, shelbymeaders@gmail.com. It's my personal email. Please reach out with any questions, or if you have questions on overdose prevention training or what's going on in Florida. But I would encourage y'all to stay on. I have about 5 to 10 more minutes of just walking through this awesome resource that's pretty new. So let me go ahead now and do that. All right, so everyone should be sharing or seeing my screen here. So if you cannot, I guess let me know in the chat. But I wanted to highlight the Harm Reduction Technical Assistance Center. This is a project through the CDC and through SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And they've produced this technical assistance center related to harm reduction, but it's not just harm reduction. And that's why I wanted to talk about it today. So this technical assistance center, in collaboration with NASDAD, and NASDAD is the partner right here. NASDAD's working with the National Harm Reduction Coalition, the University of Washington, who's a great research facility that does a lot of like data collection within the harm reduction realm, data collection and analyzing and all of that fun stuff with data within the field. But there's also prevention partners, Prevention Institute, National Council for Mental Wellbeing, the Mosaic Group, Faces and Voices of Recovery, Collaborative to Advance Health Services, and NACHO, well, I like to call it NACHO, but NACHO, the National Association of County and City Health Officials. So all of these partners come together and they review TA requests that come through. So if you're looking, you have a question, whether you're a community-based organization or you're with the health department, and you have a question related to something you're doing, whether it's a syringe service program or an overdose prevention program or a Narcan program, and you're wanting to talk with a subject matter expert on a national level, this is a great place to do it. And again, this is a pretty new project. It's again funded through CDC and SAMHSA, and they're incorporating not just your harm reduction technical assistance providers, but also the prevention as well. So here's our prime example, or another prime example of a collaboration between prevention and harm reduction. And so I'm going to go ahead looking at the frequently asked questions here, which is this screen. You can see like, well, who can request it? Well, it can be anyone. It is free, whether you're a health department or a program that has treatment for substance use disorder, or you're maybe an RCO, recovery community organization, or a prevention or recovery group. You can utilize this. And I really have to, I love the National Alliance of State and Territorial AIDS Directors, which is NASDAD. It's a name. It's a bulky name, but NASDAD is a great partner who's coordinating this effort through the CDC and SAMHSA and providing a lot of great information all across the U.S. So it kind of just gives you some information here on what that looks like with how long the request takes. It's not long. So I would encourage everyone to go to this resource if you're looking to start a program related to overdose or prevention, or you're wanting to maybe look at best practices, or just talk to somebody who knows what they're doing. And this again is through the CDC, but the link is harmreductionhelp.cdc.gov. And then if you're like, well, you didn't give me enough info, Shelby, what can they help me with? I broke it down even more for you. So if you go to their resources, you can see all the different resources on what we're working with. So you can click these resources first if you'd like before contacting them, but they can help on everything related to fentanyl test strips and drug checking, to different funding opportunities, to how to start a harm reduction program, the data and evaluation that goes along with harm reduction programs. You can look at just their collection of webinars. If you're working with a specific priority population, you can click the different groups here to see maybe what resources. So again, really, and they even have the SAMHSA, the harm reduction SAMHSA, looked like they provided resources when SAMHSA released the first harm reduction grant last year. So there's some really cool things. This is the one resource I really wanted to highlight to kind of show you that there is help. There are subject matter experts and technical assistance available to help in harm reduction, in prevention, and it's here for you. Let's see. I'm going to go back to the chat and just see if there's any questions. It looks like I do, and while I have these on my screen, I do have the overdose prevention strategy, the U.S. Department of Health and Human Services website up. So I mentioned the HHS, so the U.S. Department of Health and Human Services. This is the 4 pillars I was talking about. So of course, I don't have too much time to go through and navigate the website, but if you go to hhs.gov/overdose-prevention, you can see each of the pillars, and again, first of its kind at the federal level, to see kind of what resources are there for primary prevention, harm reduction, evidence-based treatment, and recovery support. So there's some great information and statistics on here as well. So you can see some great information here. And then just real quick, looking at those press releases I mentioned, because I only mentioned a few snippets of each, but you can go through. This is the one from April, talking about focusing on naloxone and reaching young people through educational campaigns. So this goes through and just, I mean, they're lengthy, so it has some great information and kind of what they're focused on. And then just the next, my last tab here just shows a press release from August. So talking about when they announced the actions they were going to take and the collaboration amongst harm reduction and prevention, which are both mentioned in here. So I really think, driving that home, it's gonna take all of us. I was really excited to do this webinar to talk about the intersection of harm reduction and prevention, because we're all here working towards the same thing, especially in Florida, and we can do better and be better with collaboration. So it looks like that is my last slide. I would love to stay on for 10 minutes to have discussion, or if anyone has any questions, or again, you can email me, but I'm happy to talk about it here. I really hope someone took something home with them today or learned something new. And if you didn't, I'm still super, I'm glad that you stayed on for the full time today and stayed on with me.
Well, thank you so much, Shelby. We'll give everyone just a few seconds just to see if anyone says anything in the chat. I'm mostly seeing thank you for such a good webinar and all of that information. I hope you can see it. Let's see if we can give people a few seconds if they have questions. Okay, I'm not seeing any, so we'll go ahead and conclude. Thank you so much, Shelby, for all the work you put into this and just all the great information that you shared with us today. I really appreciate it.
Absolutely. Thank you so much. And please reach out with any questions.
So everyone, please see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FADA's website. If you want to receive CE credit or a statement of credit for this event, you must complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida healthcare practitioners, you needed to provide an accurate Florida Department Health license and prefix number when you registered for this webinar. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for our webinars and when you set up your profile in FADA system, as this is the only way to connect your attendance and your profile. After you register or sign in, you will be directed. You will get a second opportunity to complete the evaluation through a follow-up email later today. That email will come from WebEx. Please remember the evaluation will close at midnight on Friday, May 12th. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. Thank you all for participating in today's webinar. We'd also like to recognize and especially thank the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and you will be directed onward to the evaluation when I close this webinar. Thank you so much again, Shelby. We really appreciated it. And please don't forget the evaluation will close Friday, May 12th at midnight. Thank you all.